All right. Well, welcome everybody. Glad to have some crew here in the house with us. I'm Dr. Kristen Zawada. This is Monarch Family Chiropractic's Tuesday night spinal workshop. We're going to talk tonight about our longevity numbers, our knowing your numbers, knowing what those numbers mean and which ones are important to know. So we're going to jump right in as I'm starting a few minutes late today. And so we can get our PowerPoint moving. There we go. Okay. Make sure you're seeing what we're seeing. So when we talk about longevity and the numbers that matter, I think a lot of people, when they assess their health, look at what.
Hi.
1 second. I love Bug.
Oh, you better mute us. I'm on my phone. I don't know how to do it on my phone.
Give me 1 sec.
Okay.
Oh, I don't know why this won't.
I think so too.
Right. There we go. All right. Oh, I just hit the wrong button. See if I can back up. Always does that. There we go. So numbers that we talk about a lot in health is when people go and get checkups and really think about maybe their cholesterol, their blood pressure. A lot of us know what those standard numbers are, right? Across American Heart Association and things like that. Even in this day and age now, needing to know what our sugar levels are, right? What our blood glucose levels are. What is our weight? A lot of people know what BMI stands for, right? That body mass index, knowing what our range should be for our age, our size, our height, our sex, right? And how we rate, if you will, on all those levels. With spinal health, you see us assessing a lot of different things in here besides those things, right? Sometimes in addition to. So as all those levels are important, we want you to know your numbers of things that are also in how your body functions and moves. Because if you've been on any of the workshops, even lately at the start of this year, a lot of things have been based around you understanding how mobility and how mobility in the nervous system goes across the board of multiple places and how your body represents that level of health, right? So whether we're talking about X-rays and curves, or we were talking about posture and how we distribute our weight in our body, all those things are spinal health related that, again, support the big picture and system, because if our brains are communicating well through our nervous system, right, through that spinal cord to our nervous system, that is what is sending the signal to where our body, our muscles are holding us in space, to what our heart does and how hard it works or how much at ease it works in activity versus even at rest. And so all the different things we're assessing in here have to do with things that we can apply to our overall health and affect those numbers, like blood pressure. If our body doesn't process things correctly because it doesn't get a proper signal from the brain through the nervous system, then we can't just change glucose numbers or cholesterol by only what we eat. If the body can't process what we put in it, that would affect the chemistry of our body, right? And the systems of our body. So looking at it from the things we're assessing in here and how we're looking at how those affect the other big numbers is like what's listed there, right? You've all had a posture assessment. We may or may not have done X-rays, but that tells us a lot about the health of our bones, our structure, our discs, all the things that cushion and support us in gravity. Assessing our feet, having had a foot scan, assessing what our arches are doing, how much range of motion do we have within not just our neck, our mid-back, our low back, but all the joints of our hips, our shoulders, our knees, our ankles. Again, that goes with a lot of balance. The heart rate variability and the surface muscle, the SEMG is a surface electro muscle graph, and the thermal scans, those are all the scans you had on your spine when we were in our first visit together, and possibly subsequent visits, depending on how long you've been under care. Those are all assessing major numbers of our overall health from multiple levels, and we'll get into that. The fitness assessment piece, maybe how well do you do certain activities? right? Can you do a push-up? Can you do a pull-up? What's it like from sitting to standing, or even the speed at which you can walk? So there's all functional things that we should be assessing that aren't just our blood pressure and heart rate. So looking at posture, it's a big one that we start with here because we call it the window to your spine. It truly is. If we know we have normal posture from where our ears level on our head, where our shoulders level, to our center spine, to where our hips level, to the mid to the low back spine, it will tell us whether there's abnormal posture or normal posture within the system of the spine, within that center. So when we have an abnormal posture movement or an abnormal position, whether it's set left to right, like you see in that first picture, when you're looking straight with someone, there should be level ears, level shoulders, level hips, level ankles. From the side view, you really should have your head over your shoulders over your hips over your knees over your ankles. So in the picture, the red line is the patient. The green lines are neutral, or what normal should be, where we should line up. And the list there is some of the things maybe people have in this room and listening in with us tonight have experienced. When there is abnormal movements, then of course that can create things like neck and back pain. But more often we see things where muscles don't move right. There's scoliosis or curves in the spine that have developed over years of that abnormal posture, as well as other symptoms like headache or things that leave the midstructure at our posture center, which is our spine, and affect things further out, like carpal tunnel, things into the shoulders, things into the knees and ankles. So big assessments as to how it affects the overall areas of the spine and then their movements. We also look to X-ray, right? That is where we can see if something is degenerated and aged, or if it's looking normal and moving normal. So if we don't see good movement, or we see abnormal posture or abnormal movement in your ranges of motion in your exam, then we want to see, well, how long has that been there? And usually the easiest way to see length of time something's been there is by the X-rays. If there is a different change in bone, so hopefully looking at that spine degeneration graph there, or the bones there that are sitting there from left to right, the left ones should look different than the right ones. But the left is a very healthy bone that's very square and boxy. And the disc, that gray space in between, above and below each bone, is very thick and plump and cushiony. And so as you work your way down, the ones that are changing shape because they do not move right, they have abnormal movement or abnormal posture and position, is what we call subluxation, right? Those are the things that are changing the way in which the bone can move. If it can't move fluidly or isn't in the right postural curve, that puts stress upon the system. So then the bone ages faster and you start to see that degeneration or arthritis. So when we've looked at X-rays, like an example of this full spine picture on the far back, or the far right there, you're seeing that. Sorry, I apologize. But this keeps popping in. Up. There it goes. It can look very different. So what I did is just pull actual patients' X-rays from this year, actually just the end of last year, and mid-year last year, of a very common place to see degeneration or aging in spines that isn't healthy, that isn't normal, and that doesn't have to happen just because you're older. But hopefully after even just looking at that quick little picture of a healthy looking bone versus a bone that has different bony protrusions or shape, that there's a difference between, if you guys can see my mouse here moving, there's a difference between what's going on at the top of this picture and square boxy bones with big spaces in between them, and bones right here that look like they just join each other and don't even separate. And that over time, a lot of time, has age degenerated and does not move now normally. So that's all changed with posture over years. None of this kind of stuff on X-ray happens overnight. It happens over decades. So when we can see X-rays, it really helps give us an assessment of health and how long someone didn't have proper motion or function or movement. And I didn't think to put this slide in there right here, but I should have, and I will for next time, is that how does that correlate to health? Well, the last three nerves of the neck there that come out of those openings that you can barely see right now for those three bottom structures of the neck, that is everything that's helping function thyroid, larynx, the start of digestion, things with swallowing, all of the nerves and signal that go out to the shoulders, arms, and hands. So when we test things like grip strength and you squeeze that, oh, I forget the medical name for it. It's left my mind. But when you're doing those tests, that tells us if you have a good score, a low score, an average score, or a high score, how well is that signal leaving that neck and getting out to your arms and hands? So there's degeneration there that is not just depleting the function of the neck, but the ability to use and grip with your hands and use the function of your hands over time, as well as that controls things that start heart and lungs right through here. Your diaphragm is more run by the nerves in your lower neck than it is by the nerves here where your diaphragm is at the center of your like belly, if you will. So all those things very important to big picture of how your system functions. Low back, same thing. In brief, this shouldn't look the same as it does up here, right? So there's bones that are boxy and square with space, and this bone here that is slid way forward from this tailbone, and there's a big bony protrusion right there. And again, we look at these every day, all day, so that wouldn't be something I'd expect your eye to see, but there is a bony protrusion that is like an inch long that shouldn't even be there. So that is over decades of wear and tear on a low back of a person that came in with extreme pain down the legs and couldn't stand up. So the X-ray makes sense, but that stuff was, again, forming over decades of time. So now my mouse isn't working again. Sorry, give me a second here. There we go. Here's another way to look at posture and how that can affect someone. And we intentionally pulled up patients of all age range because I don't want people to think I just am looking like this because I am 50, 60, 70 years old. Absolutely doesn't have to be that way. I have young patients as young as 10 and 15 that have more forward head posture than some of my 70-year-old patients. So in looking at this, these are patients' pictures that have been taken over the last year from, again, first decade of life to 7th decade of life. And you can see the difference of where their red line at their ears is way forward of their shoulders. And it's actually worse in 2 of our younger kids than it is in people that are 7 times their age, right? So if you take care of your spine at a younger age, it doesn't necessarily have to look older or more degenerated. When we go into heart rate variability, this is really assessing how our body adapts to overall environmental stress and really how much reserve or resiliency your body has, your system has, and your nervous system has. So this is something we evaluate more and go into depth in the office, but you either are functioning in more of a sympathetic state, which is fight or flight, or you're functioning in more of a parasympathetic state or dominance, which is that calming, restful place of our nervous system. Now, they both have to be functioning. They both have to be on. It's not like we want one on and one off. It's this yin and yang. They both need to be able to fire at all times and be in balance or harmony, if you will. So when you are in, when you're, the white dot is you in that assessment of that scan that day. And if it is on that center line, that's optimal. We want you to be able to balance and jump between stress, fight or flight, and calm. The further you are to the left into box 1 or 3, you're in more of that stressful state dominance throughout your day in and day out. If you're on the right side of that line too far, you're in more of either a weakened state or a fully exhausted state, meaning your body's been maybe in sympathetic and fight or flight so long that it doesn't get enough recovery time to even jump into that calmer reactive state. So the 4 words given there is if you're in that upper, left quadrant and it's further off of that center line, the green box is optimal, or the green circle. The further left of that you are into yellow, orange, you're again more of a maybe uptight state, or your body's more ramped up, and yet you're still able to drop into that calmer state, and you're tolerating being in that stressful state. The longer you're in that, you have less resiliency to bounce back, and you end up in more of what we would say that distress state. If you were in the left side, but you were in that quadrant number 3, where you're dropping below into the orange and red. The longer you're there, the sympathetic just gets tired. Your body cannot be in a state of stress all the time. So if it's not getting enough reset and enough downtime to balance, then you'll fall into where the body then just in a sense gets weakened. It cannot respond as fast. And then the longer it stays there, we may see it jump up into that quadrant 2, where it's just exhausted, meaning when it needs to respond, it just almost can't. Almost like that fight or flight response is almost dormant, and it just can't even go there. So it really tells us how well or not the body has that resiliency or a reserve. So a lot of explanation, a lot of times an analogy, we use is like a cup half full. There's water in there if I need to take some out, take that sip, hydrate. There's also room if I need to put some in, so that you always have a reserve, and that your body's able to jump kind of in and out. We're not fully in a dehydrated state, but we're not overflowing where the body, we can't take more in, is one example of that. When we look at the muscle graph, this is literally how your postural muscles are holding tone to the left and right of your spine, from your neck down to your tailbone, and how they're holding your posture and carrying you. And it really talks a lot about, or shows a lot about, your energy and efficiency. So when you have a neuromuscular pattern, again, the nervous system is sending the signal to all your muscles and telling them what to do. Your postural muscles are constantly being engaged and used throughout your day as long as you're upright. So the only time they really get to rest is in a horizontal position, when you're sleeping or resting, as long as that's comfortable position to be. So tone and balance here is significant, where if your body is, and those postural muscles are overly working, that energy level it puts out is very high. So if 100% is you being efficiently using your energy, right? 100% of what the body needs is what you're giving or putting out. If it's below that, it's at a weakened state. And most of the time where it gets there is an injury, where a signal cannot get through that area. So the muscle just is fatigued and can't fire, or is weak, or it's been in such overload or engagement holding you for so long that then it drops out of that state of being able to do that any longer, and becomes in a sense fatigued and weakened. So when it's working too hard, the black line is where you are in that scan, and we want it to fall within that white space, that white almost hourglass shape right along the side of the spine there. If that black line is within that space and it's nice and smooth, that's a really good scan. That's a really good muscle activity that's holding your spine and your structure in place. If there is stress in that system, that black line goes to the left or to the right, outside of that white parameter. So in just these two pictures, these are fairly good looking scans. A weak scan might be where that black line then goes in and touches the spine or hugs it, or goes within that little purple area, which is hard for you to see on the screen, but it's right next to the spine within that white. So that total energy index is 112% on the left, and 100, I believe, 103%. Sorry, I got to put my glasses on. 103%. So that's a real normal looking scan. Anything over 100 is more stress, more energy, less efficiency. And really, ultimately, as we look at this next one with thermal, they're all about balance. We want symmetry in all areas of the spine. Again, top to bottom, left to right. So when we're assessing thermal, this is really the deepest level of the nervous system. This is how we're regulating immunity and managing inner oral organ function. So your organ systems and glands are all we get a signal in this thermal way or measurement. And so thermal imaging's been around a long time, probably the longest of all the things we measure. And that is showing more of a normal looking scan on the left, where the signal is white. And we want symmetry, right? We want a very balanced signal left and right, versus that right side where things are red. And the color scheme goes white, green, blue, red, sometimes black if there's been an injury or an area not addressed for a really long time. But a regulation of organ function is shown when there's that much red, something's been there a long time. The body's not able to adapt to the stressors that it's under. And that directly correlates in thermal imaging to your organs and your glands. So spinal movement, obviously one we do that's easier, I think, that everybody understands is that there should be, all the joints should have a range of motion, right? We're designed to be in motion. And when we're in better motion, we have better function. So those are all the degrees in which the body should move between the neck and the low back in particular, but that we have the flexibility to move forward and back, side to side, and in that rotational component and turning, right? And all those degrees are at different variables there based on the area of the spine and where it should move there. There are areas that shouldn't twist as much as others and some that should. So we assess those very specifically and individually at each level because that's very important to the functionality of how not just your spine moves as a unit, but how it supports you as a whole. So kind of going back to X-rays, your spine should look straight, right? When you look through you front to back. But when I turn and face the side, like we were looking at those posture pictures, there should be a curve in the spine, right? An S shape. That is all indicative of healthy curves that support the weight of all of you over all the parts and pieces, not just one area. So when you lose curves of the spine or have less movement, that can be because there's just not a curve to support those movements to happen, those angles and ranges of motion to happen, which is why we take X-rays when we see in the exam, we don't have the motion we were expecting. That can be because your body can't physically do that motion because there isn't a proper curve there. So again, we can't regain that if we don't know it's lost. So that X-ray gives us a lot of information about the stability of your spine, if there's a curve or not a curve there. In talking about balance quickly, the proprioception, right? The brain's ability to understand where it is in space. How foundational are you? What is your foundation? How balanced is it? Because there's a percentage that comes from the feedback from the body to the brain through the eye, right? Through what we see. Where's horizon? Where do we feel like we are in space? What we hear, about 20%, but coming from the feedback from our feet on the ground and foundation up to our brain, 70%. So when we've asked people or when we see things really different, have we scanned or taken a look at your feet and how supportive your foundation is? That could be huge to the improvement of health you can gain in all these other areas we just talked about if we're not assessing the base, our foundation in which we stand. So that's another component. There's the goniometer. Thank you. That's the word. That is where we're looking at that cervical spine health, like I was talking about earlier, based on how well you can squeeze that grip strength and how much poundage you can squeeze, basically. I had another quote and link here of information and it didn't print out for me. So there's part of that on this slide, which is just that for every 11 pounds decrease in grip strength, linked to 16% higher risk of dying from any cause. A lot of assessment we do relates back to heart health. So that is one of the main ones when we're assessing movements, we're assessing function. A lot of when we see some of those scans decrease in signal or just decrease in the ability to grip, it's because a lot of that signal comes from signal that is also controlling heart function. So important that we are paying attention to those things for longer term health goals, that we may not see it in a number like our blood pressure's off or our, I don't know how many people that are young, unless there's a problem, get on an EKG, right? Where they may, or do a stress test where you stand on a treadmill and walk or run on a treadmill and they measure everything by putting all those leads all over. We want to be assessing things before we're taking those kinds of tests and exams with a cardiologist. So we're looking at overall things that could change where that shows up in the trajectory of health for us down the road if we catch these things sooner to support heart health and other things that relate to that. So fitness assessment will be one of the last things we cover, which is just how well can we do the movements that we were talking about in that earlier slide. So movement should be at minimum 30 minutes a day. A lot of the guidelines that are there talk about what those minutes of energy and exercise need to be. So 150 to 300 minutes, but that it's short bouts of energy. And I think as we've now learned, it doesn't have to be lifting heavy weights. It doesn't always have to be weights at all. It could be resistance bands or our body weight. It's just when you put resistance into the body that just helps the joints, as well as it helps the bone density, because if the more muscle mass you have as you're older, the stronger the density of the bone and the more stable you are, right, with strength. So it doesn't have to be about weight, or muscle. It's in a sense of how strong are you in the stability component and compartment. So shorter bouts of exercise, but more often, rather than feeling like you have to be somewhere for an hour or two. Walking speed, I thought that was an interesting, calling it the sixth vital sign. What that speed should be, but that is so important to, we all know what they're calling sitting the new smoking, right? That is, people with sedentary jobs is just as bad, if not worse, to many health conditions long-term than it is to smoke. And so that's kind of replacing what people used to do that was creating those kinds of, health and heart conditions. So the more we're up and moving, we don't have to be a runner. We don't have to do miles and miles and miles, but we do have to be moving. So that walking being a big part of how to get, several thousand steps in a day is just about moving. Push-ups is another piece that there's lots of different research and stats out there about how much can you do, or at what is the minimum, I guess, that you want to be able to do. But it just talks about there's such, again, a correlation between lowering cardiovascular disease when you can do certain movements of even just your own body weight. So I'm going to see if I've got more. Let's see. Oh, it's here. So going through sitting to rising exercise, known that aerobic fitness is strongly related to survival, right? But also showing that maintaining high levels of body flexibility, strength, the power to body weight ratio, and coordination are not only good for daily activities, but have a favorable influence on life expectancy. So if I'm reading that straight off the slide for those of you that are maybe tuning in by just audio and not visual and not seeing the slide. So there's just different movements that even just doing a sitting to rising test of how well can you do those things by involving different motions. And I realize my screen, it might be in the way of some of that. Let me see if I can slide it out of the way. There we go. So the depiction of the sitting rising test, right? So involves standing, sitting, and then rising back up in a smooth motion without relying on the use of our hands or any other external help. So what you're seeing is the picture of someone trying to go into that kind of cross-legged position without using hands, and being able to come up from that position without using hands to support ourselves. And again, a lot of things have to come into play there. A lot of balance, a lot of knee movement, right? A lot of ankle movement and hip movement. So there's different ways in which you can score yourself. And this probably is an easier one to just maybe look up and read deeper if you want to try it and attempt doing that motion yourself. But again, it's just showing physical fitness, but really balance, coordination, and then just where do you have flexibility and where do you not? And that might just be helpful in assessing, okay, we need to add some things in to gain some flexibility in other areas to, again, just improve our overall support. So that is end of slide workshop presentation tonight. If I can, I will try my best to open this up if anybody has questions that they want to ask while we're here. And I don't know why I feel like it doesn't let me, it lets me mute everybody, but it doesn't let me unmute everybody. So you guys may be able to unmute yourselves. I know when I feel like when I disconnect our cord, you guys can hear, I can hear you guys. So I'm going to disconnect the TV cord, but hopefully through video, we can still all see each other. And I realize you guys won't get to see that on the TV, but I feel like when I do that, then I can hear everybody who's chiming in. So with those of us here, any takeaways from that were something new that you didn't know before tonight? Or that maybe something you want to test because you've never tested?
I want to try the sitting rising down.
I can't remember the last time I did the sitting rising test.
That I'm doing
Right there. Well, maybe that's gonna, maybe that'll be our yeah, yeah, in our huddle, maybe we'll see how many of us can do sitting rising.
I was kind of amazed that the diaphragm is more controlled by the nerves in your low neck than the nerve near your diaphragm.
Mm-hmm. And of course, there's a lot of crossover. So if you guys can hear or not hear what's happening in office, is that people were surprised that the nerves in the neck are really controlling a lot more of the diaphragm. There is tons of crossover. I mean, we have thousands of nerves within our body, and there is lots of a multitude of them that go to the same parts of the body, right? There's not just one nerve to the heart or to, and yet if there's damage at the neck, the diaphragm cannot do its function. So sure, is there some innervation that happens from the ones lower in that middle rib cage? Yes. But the main ones start way higher up than you would think, right? You gotta think, well, it must go right across from where it is located in the body.
So that's a good question. On one of those pictures we showed the spine.
Yeah.
Starting from the neck
Where the degeneration was. Yeah.
So can that be repaired, or is that?
At that level, no. So catching that now, we're just supporting it not getting worse and trying to stabilize the areas above or below that are still moving well. But no, those things that in some of those X-rays where those have shifted far forward, or the spine had fused together or had joined together, that's happened over decades. That isn't anybody can undo. In a sense, that's the body's natural way of joining it to where it can't get more, to try to create stability. So it's been forward and compressed for so long that bone formed over time to start. I didn't put a picture in there of this slideshow, but in the ones when we talk about curves, we have a few of those recordings on the YouTube channel already, but the ones that are to come, any of the ones that talk about the vital curves or the healthy curves, we talk about that and show different stages of it to where you can see where it's still correctable, where bone's starting to make little like pointy, lippy kind of hooks, but they're not joined. That stuff you can still correct. But once you get to a place where the body has just said, I'm going to lay down more bone, and those little points are osteophytes, as you hear, like if doctor says, oh, well, you have degeneration or these bony spurs. Well, that's just body laying down more calcium to try to create stability, to stop it from moving or not moving proper or moving improperly. So then if we catch that then and get proper movement, you can slow down or stop that bone changing or laying down more bone. But that's the body's innate intelligence to say, hey, this isn't stable. I'm going to throw more bone down over time and try to stabilize you myself because you're not giving me enough support. So a spine that looked like that in the neck has been doing that for decades and laying down more bone and then just joining over time with compression to where it just fused itself instead of you going in for a $80,000, $100,000 spine surgery where they'll just put a rod and a pin and fuse it for you. So that was the body's natural way of just fusing it itself to try to create some stability from that forward tip or that compression. So not knowing that patient years ago, I have no idea what they looked like maybe when they were 20, 30, or when that trauma happened, or if it was literally just more repetitive over many, many decades. Sometimes there's more trauma like an accident or fall or injury that creates that to happen faster. But most of the time, that's just a lot of wear and tear over a long time. But that patient did not come in with neck pain. That patient came in with screaming sciatic pain down his leg. So we took a picture of everything because his neck didn't move at all, even though he didn't have pain there. And yet, if this signal isn't clear, how good can we get that signal going down from here to his low back and tailbone that control that sciatic nerve that runs down his leg? If I only worked on the hip and never did anything to support, we never did anything to support the upper third or half of him where that signal's got to get through, I'd be doing a disservice to just address where the pain was. Now, there's nothing we can change about that. There's nothing to correct about that, but we could get movement and keep as clear of a signal as we can to get from the neck to the mid back to that low back to the tailbone to that sciatic nerve. Yeah. So the more we know, right? And the more we understand how those motions and all those functional tests we do relate to the overall health of our body. Because then think about somebody that, I mean, there's also other conditions that it's not why they came to us, but it makes sense why heart and lungs in different areas have more stress upon them, because there's more stress upon the system that helps them run, besides the pain that he was in. So that we do see things that correlate, which then it's helpful, I feel like, to show and make sense of things and show areas that they can still improve, because there is still healthy areas around those degenerated areas. So again, it's like, it's really, that's why I say age is such a number, is because there's so many patients that I have that are way more active than some of my patients that are 30 years younger than them. And I'm like, if you can see where you are now, you can change that trajectory. We don't just are, feel like you get older and that means you age to where you can't do stuff if you take care of things earlier on. So I guess the point of that is none of that is stuff that happens overnight or happens just late in life. It's everything we can do in those earlier couple decades that make us what we end up with when we're in our later years, and can prevent a lot of those things from happening, or at least slow them down. I mean, we're all aging. It's not like I'm saying we don't age. We defy, the physics of everybody else. It's that we could slow it down, right? And some of those things like curves, that's reversible if you catch it when it's in an earlier phase than the ones I showed you. So most of our patients, we are catching that earlier. That is an instance where there was nothing more we could do for that. But that I like showing that because it's also not why he came in, but it made a lot of sense. If you have a neck that you cannot move, it's really hard to stand straight. So when he stands like this, and this was straight to him, well, sure, no wonder this hurts. No wonder the low back screaming. It doesn't have any support from the other 2/3 of him, so it's all related in that way. So just trying to connect dots there of how a lot of patients that come in with low back pain, it's not coming from their low back. I found way more than I thought I ever would in practice. So other ways to, look at things just to make sure we're understanding the whole picture of someone's health. So everyone, I don't know why I can't unmute you like I normally can. I apologize. But thank you for joining us. Bring your questions into the office. We can't wait to hear your takeaways when you come in this week and next. And we will see you next Tuesday at 5:45. Thanks, everybody. Good night for now. All right.